This morning we have Dr. Marta Cano, who's with Valley Care Clinics, and Carrie Lambrecht, who is with South Texas Health Systems, in order to give you better insight into how you can keep those millions of germs you'll come in contact with off your body. Dr. Cano and Carrie, thank you so much for being here with us this morning.
Thank you.
So let's get to the numbers first. What kinds of numbers have you seen of people coming in with this strain of flu? It's been a very impactful flu.
From the hospital side, there's been high incidences of people coming in through the ED, and it's more prevalent, of course, with our elderly and our children, and that's reflected in the numbers.
And how many have you seen? Have you seen a huge increase at the clinic?
Yes, I don't have an exact number, but I can tell you that from my experience, the numbers are substantially higher than years past. There is also another category that the CDC is using, that I'm using, and it's called influenza-like illness. So when people test negative for flu, but it looks like flu, then we're calling it influenza-like illness, and I'm, for the most part, treating with Tamiflu.
What kind of symptoms have you seen with this particular year? Because this flu seems to be different than all the other years.
It's actually the typical symptoms for patients that have been unvaccinated, and that's fever, cough, sore throat, and body aches.
And speaking of vaccinations, that's such an important factor in all of this, because people sort of, maybe they have some misunderstandings about this. Should they get vaccinated? Is there still time? Who should be vaccinated? And if they're already vaccinated, can they still get the flu?
Absolutely. I think that's the biggest point. The CDC has several points to, that they're proposing for flu prevention, and the number one is get your flu shot. The vaccine is recommended for everyone age 6 months and older, and especially in patients that have other chronic illnesses and are at risk for complications. And those are going to be people that have chronic illnesses like diabetes or lung disease, children under the age of 2, and everyone should get vaccinated, even if you've had the flu.
What about if you're pregnant?
Absolutely. That's another population that's at high risk for complications. So that's
There's misconceptions with that. People think that they shouldn't.
No, they absolutely should get the flu shot. And there's a lot of misconceptions about the flu vaccine itself. I've seen, that's probably one of my biggest hurdles, is encouraging people to take the vaccine. They think that the vaccine is going to get them ill, which is a huge misconception. I told them, no, influenza is going to get you ill.
Hey, you know what? You need to stay healthy.
Absolutely.
And Carrie, have you seen a lot of people coming in to get any of the flu shots?
Well, they typically go to their clinics, but I can tell you that our employees at South Texas Health System, and we have 2,200 employees throughout our hospitals, including McAllen Medical Center and Edinburgh Children's, just to name 2 of them. We have a 99% compliance rate of our employees getting flu shots. So when you're in the hospital, you can feel good that your healthcare worker, the nurse taking care of you, has had her flu shot, so she's not going to bring it to you, or is less likely to bring it to you. And then also hand washing and wearing protective gear is a huge component in reducing the spread of illness if you're in the hospital.
Of course, and really quickly, when should you press that panic button? When should you go to the doctor or head to the hospital?
Well, you should see your primary care doctor if you have flu-like symptoms like fever, cough, sore throat, and body aches. But fever and body aches are usually the things that bring adults to their primary care doctor. Children are usually brought with upper respiratory symptoms, even in the absence of fever. So if you have fever and body aches, I would suggest seeing your doctor. If you're having any trouble breathing, or you're just not feeling, if you're really feeling bad, then the appropriate thing to do is be seen in the emergency room, especially if it's after hours. But during office hours, most primary care doctors can deal with that issue.
We want to thank you ladies for being here with us this morning and sharing this very helpful information. And you can always head to our website to check this out and check out where you can see these lovely ladies. In the meantime, Hannah, back to you.